Welcome, everyone. We're just going to give it a few more minutes to let people log in, okay? All right. Well, hello, everyone. It's Friday. Welcome. Welcome to Services for Independent Living, Substance Abuse, and Mental Health Services webinar. Today's webinar has been brought to you by Services for Independent Living and Advanced Recovery Systems. My name is India Jones. I am the Community Services Manager here at Services for Independent Living, and I will also be your webinar facilitator for today. Just to go over a few housekeeping rules, all participants will be muted during the webinar. If you have any questions, please feel free to put them in the questions box, and we will attempt to answer them at the end. A recording will be available on our website at www.sil-ohio.org in our archived webinar section. There will be a satisfaction survey that will pop up at the end of this webinar. Please make sure you fill it out. This is how we get our feedback on how we're doing, and we also get ideas on what other topics you all would like to hear about. A copy of the PowerPoint is available down in the download handout section, so please click it if you would like to have a copy of it for yourself. If you would like to receive 1 CEU credit for attendance, and this can only be offered to licensed social workers, licensed independent social workers, and social work assistants, please select yes on that particular question at the very end of the survey that will pop up at the end of the webinar. I want to introduce to you today Stacey Henson. She is the Community Outreach Director over at Advanced Recovery Systems. We are very, very happy to have her here to talk with us a little bit more about mental health. And I am going to go ahead and give you the floor. Welcome. And thank you so much for agreeing to do this, by the way. Welcome, Stacey.
Happy to. I appreciate it very much. Love an opportunity to talk about what we do and what is obviously a career passion of mine. So as India said, we are going to go over substance use and mental health disorders. So it's kind of an overview. I might get to a little more specific, but please feel free to put any questions in there. You know, I prefer more of a back and forth, but I know the way we set things up with COVID and everything, it's going to be questions at the end. Feel free to put anything out there. Additionally, my information, my contact phone number will be on there. So if there's a more personal question or something that I can answer for you, feel free to reach out, call me, text me, any of that. So if we can go to the next slide, please. So Advanced Recovery Systems is a family of treatment centers throughout the country. We do have 10 facilities. We treat primary substance abuse or substance use disorders and do all levels of care. So we can do detox, residential, and outpatient. The bulk of our facilities are in Florida. We do have a facility in Ohio as well. So, but in Florida, I represent the Recovery Village in Umatilla, which is a tiny little town outside of Orlando, but very peaceful. It's our flagship facility, but again, doing all levels of care there. Next slide. Our facility in Ohio is in Columbus. It's called the Recovery Village Columbus. Again, we do all levels of care there for adults 18 and older, and so it can be a local resource for you guys. Next slide. And then one of our specialty programs is our adolescent program called Next Generation Village in Sebring, Florida. We treat adolescents 13 to 17 years old. And again, it's primary substance use disorders, and we can do all levels of care for them as well, detox, residential, and outpatient. All of our facilities are in network with most, oh, you're fine, you can leave it there. In network with most insurances. Biggest one is Blue Cross Blue Shield, but we take most commercial plans, Aetna, Cigna, United Healthcare, all of those. So, all right, next one. So one of the things I think that has been positive with COVID, if I want to try to be the glasses half full kind of person that I am, is how many resources have become available virtually to us. So like, I live in Tampa, Florida. I would not be able to do this presentation for you if it weren't for COVID and us getting connected a lot more virtually on online. One of the fantastic things that our facility, our company and the facilities have begun to offer is Nobu. And this is a brand new mental health app. It is in the Google Play and the App Store on iPhones. It is a free download, and it is a wonderful resource that offers a variety of things. You can set goals and track your progress, whether that's for meditation, mood, activity level. They have a lot of mindfulness exercises. They have yoga exercises. So really, if you're looking for a good support, it has a lot of opportunity there. And like I said, it is free. So it's something that you could use and track your stuff. There is the ability to do individual therapy through the app. That actually would go through insurance and all of that. But for the free part, you get all the benefits of, again, mindfulness, journaling exercises, and that kind of thing. So check it out. And if you like it, keep it. Next slide, please. So this is just a little bit about me. Again, my name is Stacey Henson. I am a licensed clinical social worker by training. I have been in behavioral health for 24 years, I'll say, and have worked in pretty much every setting that I can think of. And I joke that I took a midlife career change a couple years ago and decided to go into outreach instead of being a clinician or managing a behavioral health program. And I have truly loved it. Advanced Recovery has given me a whole bunch of opportunities to just broaden my skill set. I've really taken to being able to do programs like this and just enjoy being able to spread the word about mental health and substance use education and treatment services. So I hope you guys enjoy today. Next slide. Thank you. So we have a ton of objectives today. I'm not going to go over each of them line by line here, but we will touch on all of these. And I know she said there's going to be a feedback form at the end. I think that goes through you guys, but I would love any feedback. I'm always looking to improve my presentations, whether that's the content or the format or how I speak or how I, making sure I do what I need to do that meets your all's needs. So any feedback you give to her, hopefully I'll get that passed on to me as well. So definitely open to that. But this is what we're looking for today. And I know we have until noon. So I usually try to stop about 1/4 till or 10 till so we have time for questions. So substance use disorder, I'm assuming many of y'all are clinical. It is a new diagnostic from my 24 years of experience. When I did my initial training, we had addiction, withdrawals, and dependence, right? And so, or intoxication. So I love that it's changed. So substance use disorder is now a spectrum. And I think it encompasses a lot more, and it's going to touch a lot more people. And the verbiage we're changing from, we used to talk about substance abuse, and I catch myself every once in a while, but it really is substance use disorder. So we're looking at this whole spectrum. So we include mild, moderate, and severe. So all of those pieces come into play. It will capture a lot more people than it used to. And I think that that's a good thing because it allows us to have a different conversation. Next slide. One thing I just want to say is there's going to be a lot of hyperlinks throughout this. So if you do download the PowerPoint, it will take you to a lot of additional resources. So please make use of that. I think that's one of the cool things about what we can do now is access information pretty quickly. So most commonly used substances, alcohol, obviously it's legal. We see a lot of that. We've seen a ton of increase in usage of alcohol throughout COVID. And as a clinician, and what we're seeing is, I think that as people went back to work, or however people are still hybrid, I'm still hybrid, we're seeing how that has affected people. Benzos, cocaine, fentanyl is huge down in the Tampa area. I'm not sure about up in Ohio, but it's frightening. So many things are laced with fentanyl these days, and people are just dying randomly because of it. So it's a very scary piece. Heroin, marijuana is one of the most popular drugs available, and sometimes that's because it's legalized in some states. Some, people talk about it, oh, it's being natural, so a lot of usage there. We do have medicinal marijuana in Florida, so it is a very commonly used substance. Opioids, obviously, that's going to be a big piece that we're going to talk about today. And then Xanax is one of the most prescribed drugs in the United States, and it's so highly addictive, even if you take it as prescribed, and it is very often misused. Again, not with the goal of misusing it, but it just kind of builds on itself and happens. So we see a lot of Xanax usage in the adolescent population down here in the Tampa Bay area. So speaking specific to opiate and opioid addiction, so there is a little bit of a difference. So opiates are derived from the opiate plant, and opioids are man-made. They have very similar need or uses, for pain medication. And again, a lot of times we take these as prescribed. And if you just have a short-term thing like a root canal, for example, opioids are often prescribed for dental pain and those kind of things. And usually, I think now they have a cap down in Florida. I'm sure it's national, that you can get only 3 days of medication and no refills like they used to. But if you have someone who has chronic pain, so I have a neighbor who had a major neck surgery, and she had a rod. That's what I'm looking for. She had a rod put in her neck, and she was prescribed opiates and took them just as they were prescribed. But she realized that her body became addicted to them, and so that's one of those pieces. And that last bullet point there is so huge. 1/3 start with a legitimate prescription, and so that was her hurdle. Is I need this medication, but she was finding she needed it sooner, and then she needed more, and that wasn't how she wanted to live her life. And so, she went and talked to her doctor about it. So these are things I just want you to be thinking about. So when we look at opioid misuse, this is an important conversation, and it can be a conversation with a patient, with a family member, with a treatment provider or a prescriber. So I think if you have a pain issue, you want to create this pain management plan with your physician. There are pain management doctors specifically, and there are ones that will not work with opiates. I have a practice here in the Tampa area, and she works with everything but opiates, and she drug tests her patients when they come in, and if they start using or doing something like that, she will refer them elsewhere, because there are a lot of pain management techniques that don't use opiates. So again, knowing what your options are, talk to your doctor, learn what these are, set limits and goals for how you want to proceed. And then again, just stay in contact with your physician, because there are reasons to change medications. There are reasons to, increase and decrease the prescription. Looking at how to take them, never take them in greater amounts or more frequently than they're prescribed, because that's how that buildup happens. And again, our bodies are naturally going to become addicted. It's similar to caffeine. It's similar to nicotine. It's similar to alcohol and everything else. Like, that can be physically addictive. The more we use them, our bodies get used to it, and so we need more to get the same impact. So again, always talk to your doctor about side effects. Avoid taking them with alcohol. And if there's any other medications you're on, obviously your doctor should hopefully be aware of that, but have that conversation. Don't share them, don't sell them. And sometimes this seems like a silly conversation, but it's an important one to say, if you have meds prescribed for you, they were prescribed for you for a specific reason. And then make sure you store prescription opioids in a secure place out of reach of other people. So we did a presentation with Miss America, who is a pharmacy student, but she also is very passionate about substance use and getting the word out there, and did a fantastic presentation for us on, opiates and opioids. And one of the conversation pieces was, make sure you keep this out of the reach of your kids, regardless of how old your kids are. If they're living at home, it can be a temptation. That's one of the things we see a lot in the middle to upper middle class kids in the Tampa Bay area. They're getting meds from their parents' medicine cabinets. So be very thoughtful, be very considerate of what you have. If you've finished using your prescription, dispose of it. You can take it back to the pharmacy to have them dispose of it in a safe way. So definitely be aware of what you have and manage that safely. So one of the things I think is important when we look at substance use disorders and mental health disorders. So I've been a clinician for almost 25 years, like I said. I have yet to work with someone that has a substance use disorder that does not have an underlying mental health challenge, whatever that may be. So the top co-occurring disorders that go hand in hand with substance use are PTSD, eating disorders, and mood disorders. So PTSD, obviously, we're talking about severe trauma reaction. And one of the things we often see is people that are traumatized maybe use substances to cope. Maybe they're prescribed. Xanax used to be a huge one for people with PTSD to help them manage their anxiety and their flashbacks. And over time, we've learned that that really isn't helping them long term. But then with PTSD, the other piece of it, you have that flip side of it. Is somebody's using substances and they're under the influence, they are more likely to be traumatized. I had a young kid, 17 years old, that was referred to us that had PTSD and a substance use disorder, and his PTSD came from being shot while he was buying drugs. So again, he was already using drugs to manage something else, but then he compounded that by being in a very unsafe situation and being shot and ending up with PTSD. So his challenges in life just went up exponentially. Eating disorders, there's actually about a 45% comorbidity between eating disorders and substance use. And my clinical background is in PTSD and eating disorders. So it's really just a fascinating piece where people will toggle between using a substance, and then when they come into treatment, once that's removed, then you start to see some of the eating disorder behaviors emerge. So it's really, if you have a patient that you're working with that has a substance use disorder, it's going to be important to understand what else is going on. But if you have somebody show that has PTSD or an eating disorder or a mood disorder, it's going to be important for you to really talk through like what their substance use looks like. And we'll get to that in a little bit more detail. In the mood disorders, which just captures anxiety, depression, and bipolar. So when we're looking at patients, when we're looking at friends, when we're looking at coworkers, right, we want to be aware of what are the things we need to look for when somebody may be struggling and maybe not even realizing it themselves, or maybe not ready to talk about it. So these are just some bullets to keep in mind. Anytime there's significant relationship strain, possible dishonesty, whether there's, somebody stealing stuff, or again, some of your pills are missing from your medicine cabinet. Any struggles at work, whether that's timeliness or getting work done on time, coming in late, extended lunch hours, just different triggers there, financial issues. And those don't have to be like losing your house. It can be missing bills, right? Not paying bills late, those types of things, needing to borrow money. Any legal problems, that can be a DUI, which obviously is pretty significant, but it can also be getting, again, back to, they haven't paid their rent for the last 3 months and they're gonna be evicted. Any school concerns, whether it's kids or adults back in school, If there's, again, struggles, that's going to look similar to the work struggles, right? Not turning in homework, not going to class, missing classes, truancy, any behavior problems, a lot of anger or any outbursts or that typical kind of sluggishness that maybe you might see after taking a Xanax, those kind of behaviors. And then any significant behavior changes. So if you have a patient you're working with directly, maybe there's new patterns, they're missing or canceling appointments, maybe they have to interrupt the session to use the bathroom, which is unusual for them. So I think in general, behavior changes. If there's anything that just seems off, I think it's worth considering. And again, I don't want you to jump off the deep end and think, oh my gosh, this is the worst thing that could be going on. But it's just something to take note of, something to bring up and to discuss. So when you're fidgeting, that's funny because I'm sitting here fidgeting because I'm sitting in a different chair than I normally do. So something to look for when you're sitting with someone for a longer period of time, or just kind of noting behaviors. People get very fidgety, people sweat, maybe they look disheveled, they come in with their hair kind of a mess, their thought process gets kind of awkward or off kilter, and you're trying to follow them, but it's just not, there's no common thread. They're having trouble concentrating, mood changes. Again, it can be like in the moment from, happy to sad or happy to angry, things that just seem different. Motivation changes, any significant weight loss or weight gain, sleep changes. And then at the end of the day, as a clinician, if you're used to working with people or have been working with a particular person for a long time, we know that kind of have that sense in our gut, like something's not right, something's different, and trust that. I mean, there is nothing wrong ever with asking questions. And if there's some added defensiveness from the recipient of your questions, then that can be telling as well. So again, I've been doing this a really long time, so digging in, asking some of the hard questions is as comfortable as it can be for me. And I think it's just really important that this become a part of your day-to-day lingo, your lexicon, how you choose to navigate conversations with patients. And the more you become comfortable with that, the more you can talk with people outside of that. If you have a coworker that you're concerned about or a friend that you're concerned about. So don't be afraid to ask directly about substance use. It is a standard question in any type of clinical mental health realm. I mean, your primary care doctor asks you about substance use, right? So it is just a standard question. With my training and my expertise in PTSD, a standard question for me is always about childhood sexual or physical abuse, because that is pertinent to a mental health assessment. I have a clinical level of comfort having that conversation because it's important. It helps me understand the person in front of me. So it became a standard part of my questions, as does substance use. But I used to get referrals from clinicians in my practice that didn't ask the trauma piece up front, and they'd get 2 to 3 sessions into working with the patient, identify that there was trauma, and then they transfer them to me, which was fine. I mean, they got to it eventually, but if they had been able to get that information up front, we could have had a more direct connection in that regard. Second one here is clients may be hoping you'll ask. Sometimes people feel some sense of relief when they can actually share, and if we give them the opportunity to share, that can just kind of like take the pressure off and they just exhale finally. And if you have a patient that you know that's been in recovery, ask them what their recovery program is. Are they going to 12-step meetings? Do they have a good sponsor? What are they doing for self-care? Because people who are in recovery still get challenged. I know COVID has brought incredible challenges for people in long-term recovery. When COVID first happened last year, I work with a gentleman in Sarasota, and he said in the first couple of months of COVID, he lost 10 friends that had been in long-term recovery to accidental overdoses, because the initial phases of COVID cut everyone off from their supports because there were no virtual 12-step meetings at that point. They, maybe they couldn't connect with their sponsor and they forgot how to do that self-care. I had a good friend that she's in long-term recovery and she was really struggling. She went back to her basics. She went back to reading her 12-step, materials on a daily basis. And so those kind of things, it's still, again, an important question to ask. So how do you ask? Again, like for me, I'm very comfortable with it. Tend to be a very direct person, personally and professionally. So I think sometimes just finding a way that's comfortable for you. But I think that's the goal, right? Is to have this become part of your normal conversation and to be able to find a level of comfort, because the more comfortable you are, the more comfortable the patient or your friend or whomever will be in front of, when they're sitting with you. So you can ask kind of questions around things. You can say, how would things be without that, 2 glasses of wine a night? Because sometimes people, oh, I have 2 glasses of wine a night. It's not a big deal. I can do without it. Okay, well, that's great, because 2 glasses of wine for most, if you drink that regularly, probably isn't going to impair you a lot. However, if that person didn't drink those 2 glasses of wine, which obviously do impact them, with the outcome of how alcohol affects us, kind of numbs us, makes you feel a little more relaxed. What's it like if it's not there? And so sometimes flipping it, right, and saying, okay, that's okay. But what if you didn't drink? When was the last time you didn't, and what was that like? And what if you said, for the next few days, I'm not, and see what that impact is? Because again, people don't even think about it. They don't consider that may be altering the way they go through their day. Sometimes asking about somebody in their family, what would your wife think about your drinking? And that gives you a different perspective, and it makes them think about it differently. When you're talking about patients that are on prescribed medications, do you ever take an extra dose to feel better or feel different? Do you ever run out of your prescription before it's due for a refill? Have you ever used illicit drugs, right? So heroin or marijuana, if it's not legal, right? I mean, and then a simple one is, has your substance use changed recently? And for most people during COVID, it did. I mean, if they used substances before, there was most people reported an uptick in that. And one of the cool things that I love about advanced recovery is we did a lot of research. We always do research, but during COVID, we sent out a ton of polls. We did a lot of good information gathering. So one of the resources at the end of this is, it's called the Recovery Village, which is kind of our overarching website presence. And there's a ton of information, articles, data, interviews, archived videos, like you guys archive your videos. So I really recommend you checking that out as well. All right, so like I was saying before, I think how we talk about things, the word choice we have is important. And some of it is about the way we feel about it and the way we talk about it, but some of it is about how it's received. So phrasing your questions impacts the way people receive it often, right? And that whether that's your tone, your word choice, your body language, but like I said, substance use versus substance abuse. Abuse is just an old word. We don't use that anymore. Those of us like me that have been around forever, sometimes it comes out, but it truly is, we want to talk about it as substance use. Going into treatment versus rehab. I mean, I work with a lot of people in recovery and they talk about it as rehab, but when we look at it in the grand scheme of things, we're looking at it as treatment. I mean, this is to treat the illness and treat the underlying mental illness, because it's not just rehab. It's not like going in for, post shoulder surgery where you're doing exercises, right? It's important like that, but it's a little bit different. And then talk about it as a person, as a patient or a client, not as an addict. Addict has a very negative term and a kind of negative phraseology. And different programs have different word choices. There's a program that I've worked with before, and they call the people that are in their program participants because they just felt like that was a nicer word, and the participants like it that way. So again, word choice can be huge. And bottom line, trying to find ways to phrase things so it comes across in a caring and compassionate way without a shaming or a blaming kind of tone to it. So again, maybe that takes practice. Maybe substance use disorders are very personal for you, whether that's something you've struggled with or a family member. So just kind of do that self-check. How do you propose this? How do you bring it up? And how do you talk about it? All right, boundaries. This is one of my favorite things. I think that boundaries are so important to in clinical work, period, but also in professional relationships and also with friends, right? I mean, there is a limit in every relationship we have, and it just maybe varies based upon the level of intimacy or our role. So when you're working with patients and clients, just keep things professional, be very clear about expectations, be a support, but set limits. You know, what you need to know only, and try to keep judgment out of it. I mean, that's easier said than done. I mean, I've heard some pretty amazing stories in my 25 years, and some of them, if I think about, I can kind of do the jaw drop and be like, wow, which is not necessarily judgmental, but it definitely conveys something to the person you're speaking with. Have a plan. So if you know you're going to have this conversation or a little bit heavier of a conversation about substances, know what you want to do before you go in there. Have resources and ideas about what that referral process might look like, and have a support in place for you and the client or the staff involved, because everybody's going to need that extra support. It's just a lot to manage, and it's just something we need to do. And that goes with mental health as well. I used to be the social services director at a Baker Act receiving facility, which is involuntary placement down here in Florida. And that was part of my job, was to Baker Act patients if they changed their mind or they were unwilling to stay and they needed treatment. And for me, I would always have an additional staff member, but my conversation was always about respecting their rights and saying, look, you have a right to decline treatment, but right now you're at a place where you need the treatment and you're not able to see that clearly. But if you would be willing to come involuntarily, you'll keep the rights to be able to leave, and we don't need to bring you involuntary, because I think that can be, it's about respect, right? And it's about giving them as many opportunities to keep their rights. And so the same is true with substance use. We in Florida, we have a Marchman Act, which is an involuntary placement for substance. So it's a similar thing, like whether you use it as leverage or not, it's a conversation about, well, look, we do have choices and you are in control of this to a point. So I just think it's a good conversation to have. So this is a really long list, and I am not going to go into all of them, but there are a ton of screening instruments for substance use, just like there's a ton of screening instruments for mental health, and I don't think we have a slide for that one. But this is a great list. I don't know that it's exhaustive, but you've probably heard of many of them, like the Audit and the Audit C are pretty common. The CAGE is a good one because it's really short. One of the ones that I thought was cool that where is it? The Tweak. I thought that was an interesting one. And then there's one specifically, the POSIT for teenagers. So all of these are pretty standard. You can find them online. I don't know if you have like an electronic health record. A lot of electronic health records now have access to these. And I think they're really useful. I mean, I used my old private practice, we had screening tools for PTSD, for eating disorders, in addition to just like clinical questionnaires. So I think all of those, having those handy, again, in the virtual world, they are accessible. I know sometimes they're still doing pen and paper, like my daughter's pediatrician. Every time we go in, every year, she gives her a PDQ or PHQ. PDQ, it's a chicken restaurant. the PHQ-9 to screen for depression and anxiety. So it's just a quick questionnaire. My daughter's like, I don't even know what to say. I said, I don't want to answer it for you. You need to do it on your own. And so I think those things, people are becoming more open to receiving them. And again, I think that's a good thing. I think we need to have this conversation about mental health and substance use more frequently and more in depth as needed. When we're looking at treatment options, so, and this is specific to substance use, but there are obviously parallels with just primary mental health. So treatment options, we have medical detox. With primary mental health or primary substance, there is a residential level of care. Partial hospitalization is the next step down, and that's true for substance and or mental health. Then we have intensive outpatient, and then we have outpatient and aftercare. So some treatment facilities will offer all of those like ours do. Some will only offer certain pieces of that. Sorry, I have a nose tickle. So it's important to know what level of care the patient or the client or the friend or family is in need of. When you're looking for a program, and again, whether this is for you, whether this is for a client, whether this is for a family member or a colleague, these are things to look at. If it's a medical detox, you want to make sure that there's a physician or a psychiatrist on staff. And they have nursing through, 24 hours a day. It's important to look, do they have master's level counselors or a certified addiction professional? Again, these are pretty standard. So if you have a facility that doesn't provide that level of clinical care, then it may not be the best fit for your client. Structured programs, make sure there's individual therapy, family therapy, group therapy. There needs to be psychoeducation around the mental health or the substance use issues. And some, I already said family therapy, but some sort of a family program, because when mental health and substance use don't just affect the person, right? They affect their whole system. And when we talk about this, I mean, one question that I get when I do interviews a lot is, what does a substance use client or a mental health client look like? And the reality is they look like me. They look like you. There is no discrimination at all. Sorry, just lost my screen. Okay, I'm back. So evidence-based care, that's kind of a buzzword, but it's important, right? These are curriculums that have been researched out the wazoo, so we know they work. Important to use with, and cognitive behavioral therapy is one of those, but like with PTSD, we use EMDR in our facilities. I'm trained in prolonged exposure, which is another common one. And so those are important. What do they use? Pay attention to continuity of care. They need to be able to provide step-down options, whether that's with their treatment facility or good discharge planning. I mean, I joke, it's kind of trite or cheesy, but we literally start discharge planning for our clients upon admission. And that's the other part of my role. Once we get a patient into the facility, I will get an email or information from case management saying, hey, we just talked to Susie. She wants to come back to Tampa, but she's going to need an independent, private clinician and a psychiatrist. Who do you know that takes her insurance and you recommend? So in that referral process, we've vetted all of the people we work with to make sure they do offer good care. So I think that knowing that they work well with the patient, throughout their continuity within the facility, but then with the discharge planning as well. Are there specialized tracks? There are differences in diagnostics, right? So when you have somebody that has PTSD versus someone with depression, there are different manifestations of that. Our Orlando Recovery Center used to have an eating disorders program within it, and it had its own unit, their own dining room, And even though there was the comorbid substance use disorder, there were differences in the treatment protocols that they needed. So they had their own groups specific to the eating disorder piece with dietitians and looking at that mind-body connection a little differently, but then they would still be in the mainstream of the substance use. So those are things to ask. If you know the details about your client and what they need, just ask those questions, because there are good facilities out there that do offer different specific tracks. And then accreditations are important. We have DCF down here, JACO, CARF is another one. Just like if you're looking to refer somebody to a sober living, they need to be FAR accredited. There's reasons for those accreditations, and they just set expectations, policies and procedures, all of those pieces to make sure things stay in line. All right, so here is just a quick blurb of resources. I guess I went through that really fast because I don't think we have much left. But I think it's important. These are pretty general, but Psychology Today has a wonderful resource of any clinician, well, any clinician can sign on to it. They do vet that they're actually a clinician, but they usually have a bio about themselves, what their specialties are, the insurances they take, whether office hours, location, all of that. So you can search by area, you can search by specialty, you can search by insurance. So it's a great resource. SAMHSA is a national agency, and they have great resources as well. It's not as user-friendly, but they have a lot of stuff on there. And they also have good treatment stuff, and you can get a lot of free flyers and treatment brochures and that type of stuff from there. Like I mentioned earlier, primary care physicians can be a great resource, whether that's, managing low-level anxiety or depression, which is pretty common for primary care these days, or helping to, manage medications. EAP, so Employee Assistance Program. I don't know if your agency offers that. Many agencies do. It is a great resource that agencies and employers, that's what I want, employers offer their teams, and it's usually free. So even if it's just a cursory glance at shoring up something, it works great for life events, bereavement, divorce, those kind of things, because you can do 3 to 5 sessions and really try to get those things taken care of. CDC is a great one. Maybe somebody has a current therapist and they need to be referred back, like, hey, when was the last time? Or maybe you need to step up. Instead of going once a month, maybe you need to get back to every other week. Many people in recovery have sponsors. Not everybody goes the 12-step route, but that can be a huge benefit and support to them. And like I said before, the Recovery Village, this isn't a hyperlink to our website, but the Recovery Village has an inordinate amount of information, articles, research, previous presentations that have been done throughout the last couple of years. All of it's on that website. And then I listed myself, obviously as a resource. My number's there as well if you have any questions for me. And we do have a Columbus team. We have 3 people in the state of Ohio. So if anybody, if you need to be connected with someone there, I will be happy to connect you with someone local. And I think that's all.
All right. Well, thank you so much, Stacey. We're going to go over just a few questions really quick.
Sure.
The first question that I have for you is substance use disorder also a mental health disorder?
Yes. Anything in the DSM is, I see them all the same. So I think we just specify it differently because it can be, a lot of people like it separate, and I think some of that is stigma, to be honest. But if it's in the diagnostic, the DSM, it's part of a mental health disorder.
All right. So the next question is, what do you feel is the best way to approach someone about their mental health?
Honestly and directly, I think that it's just, if you're concerned, and I guess depending upon who it is. So if it is a patient, that's more business-like, you're going to just be more direct. If it's a loved one, a friend, or a colleague, it can just be, hey, I'm concerned about you, right? I've noticed some things seem a little different. So coming up with a way, make sure it's private so that they don't feel overwhelmed by it. But I think just being honest and direct, I'm concerned, things seem to be different. Can I help?
All right. The next one, do you feel that substance abuse can also cause people to have depression issues?
Yes, absolutely. I think that any substance use can affect our mental state, and that can affect people differently. And what I would like to say is, I mean, like alcohol, a lot of people think of alcohol as, oh, I have a lot of fun when I drink, but it's technically a depressant. So sometimes it's about education, but sometimes the substance use just highlights what may be the underlying mental health issue. But chicken or the egg depends on the person. But yeah, I think absolutely substance use can add to any mental health issue.
Right. And so this last one, in your experience in your field, which drug do you feel takes the most toll on a person when they're trying to recover?
Hmm. Well, so I have a couple of answers for that. I don't think I have just one. Alcohol is actually the most deadly for detoxing. Actually, I shouldn't say deadly. I'll say dangerous, but deadly is true. I mean, like it is the hardest detox for the body, and it is the most. It is the most deadly and the most dangerous because the body just people can have seizures, cardiac arrest. There's just a lot of scary stuff that goes with that, and because it is legal and a lot of places it can be very difficult for people to avoid that. I'm going to throw eating disorders in here a little bit because recovering from an eating disorder, it's not like you can just say I'm going to remove the substance, right? Because you have to learn to navigate life with food again. So it's renegotiating that relationship completely. And so I think that's those are the top, but I think the reality is one of the other ones I guess I will say that is just really scary is people that use opiates and opioids. So heroin, because if they get off of them, and if they happen to go back and use, we get so many people that have an accidental overdose and die because they have, they were clean for a period of time and they went back to using what they had previously used and their body just can't take it. So I know that was a variety of answers. I hope that answered the question okay.
All right. Well, I just want to thank you to really thank you because this subject is a very sensitive subject for a lot of us. I can relate to having someone in my family who's been addicted to, drugs and also has been diagnosed with a mental illness. So I know how, daunting and, heartbreaking that could be. But I just wanted to shed some light on the subject from a professionals aspect because, you guys are the people that we always look to and hope, that you guys can actually help someone in our family or even ourselves, if we ever needed it. So I want to thank you for your service and just wanted to, if you could possibly send me the information for your representatives that represent here in Ohio too, I'll make sure I send that out to everyone just in case, they might want to reach out because I know you're a little far. We would love to come that way, but with COVID and everything, it's just, all about us being safe. So I wanted to just say thank you again. And thank you to Ashley Tate, who is the event director for
Yes,
setting all this up. Ashley, don't you want to come on and say hi? We want to see your face. Yes, I want to thank both of you. And I will definitely send that information out to everyone. And everybody, is Friday. So, have a great weekend and stay safe, please. And we'll be in contact in the future, of course. Thank you, guys. Thank
Absolutely.
everyone.
Thank you for the opportunity.
No problem. Everybody have a good day.